Welcome, everybody. I'm Sebastiano Nutarelli, one of the board members of the International Arthrofibrosis Association. And we are here today, glad to be here today, actually, with Nikos Apostolopoulos, which agreed to spend, I don't know, 30, 45 minutes, we'll see, of his precious time to share some knowledge around microstretching. So, Nikos, first of all, thank you very much for being with us.
Thank you, Sebastiano, for having me. It's an honor, and I look forward to working with you on this podcast and having some fun.
Fantastic. So the idea of this interview, as we have done already with the IAA in the past, it is to share knowledge and involve people that can bring additional knowledge to such a complex pathology and the way to approach it, both on a surgical way, on the surgical standpoint, but also rehabilitation wise. Which is going to be mostly the topic of this interview today. So the goal is to discuss this with Nikos, that is also the author of the book that was edited in 2018. The book is titled Stretch Intensity and Inflammatory Response, a Paradigm Shift and Microstretching, or I would say microstretching is the real title of the book, and Nikos will guide us through it. As a brief introduction to knee arthrofibrosis, which is the topic, arthrofibrosis, which is not just happening in knees, but is happening in knees in a peculiar way. It is a fibrotic process involving joints. This happens for multiple reasons. There are multiple drivers, but in the end, what the patient experiences is range of motion loss, flexion and or extension, or quite often, again, the combination of the two, patellar restricted mobility, and in the end, this sensation of having a stiff knee. This also obviously leads to a quite low and decreased level of function, independency, impacting on their lives in a quite relevant way. Biologically speaking, this happens again for a long list of reasons, but anyway, just to sum it up, we do have unregulated healing happening, and what happens in the last stage is the myofibroblast that should happen when healing is needed. After a certain amount of time in activity and activation, should stop producing scar tissues. They don't in arthrofibrosis, so it's a sort of a healing loop, and this ends up to fibrosis within the joint, interarticularly outside of the joint, and sometimes also involving the capsule per se, gluing everything down. The interview of today is in relation to microstretching, because Nikos again published and released a book on that, edited a book on that, and it will be interesting to get a bit deeper knowledge into what we can do better with this patient. So Nikos, I would say, why do you think stretching is helpful for overall for patients with arthrofibrosis, and when it's done properly, appropriately?
Thank you, Sebastiano. First and foremost, thank you for the introduction. I just want to say that Stretch Intensity and the Inflammatory Response, the Paradigm Shift, the book that I wrote, is actually based on my thesis, my Ph.D. thesis, looking at gentle stretching, which is what microstretching is about. So why is stretching helpful? Well, I believe that when it's done properly, stretching can improve range of motion, balance, and posture, and provides improvements in movement efficiency and muscle coordination, and to some extent reduces risk of injury. Post-exercise, I believe that stretching helps to relieve stress and enhance relaxation. And that's the key, relaxation. The key phrase, the other key phrase is done properly. By proper stretching, what I'm saying is about providing the body with appropriate information to help the muscles maintain function, but more importantly, to address any injuries or musculoskeletal issues, which is what arthrofibrosis is. So basically, arthrofibrosis provides the body with an information, and how does the body interpret that information in order to heal and be able to move, allow the person to move efficiently. So, but in my observation, Sebastiano, and again, there's numerous ways of stretching. There's numerous techniques out there. Not one is the panacea of all things, but in my observation, what I've noticed is that when stretching is aggressive and non-supportive, that is, it causes pain and discomfort. I believe that, and through my research that we're going to discuss later on, that I believe that it can increase inflammation and hinder the body in terms of properly recovering and regenerating.
Okay. Yeah, I didn't mention about the research background. Obviously, this is underpinning all the material you present today. This is for us as IAA. I want to mention that it is crucial. We try also to put out there something that has, some level of
Mm-hmm.
validation or anyway scientific
Mm-hmm.
research in its background. This is crucial. So do you think the principles of stretching do apply in the same way, considering the health status of a joint? Let's say we are dealing with a joint that's healthy overall, or maybe a knee with the arthrofibrosis. Is it different? What changes and to what extent?
Well, again, and can we share the screen for this one?
Yeah, sure, you can. You are.
Okay.
And let's see, I'm not seeing it yet. Okay, now you're full screen figure one. Okay, let's pretend you
Oh, can you see this? Perfect.
I do. Yeah.
Oh, fantastic. So again, you said, is there anything different with regards to the principles of stretching and arthrofibrosis or a healthy joint? Again, this is my experience and the knowledge that I gained through developing stretch therapy and microstretching. I specifically look at the parameters involved in stretching, the intensity, duration, frequency, and volume, and the technique of stretching. I think that's very, very important. Again, with my work and my research, what I've noticed, and it is my belief, working with professional, elite, and amateur athletes, as well as people suffering from osteoarthritis, rheumatoid arthritis, fibromyalgia, chronic fatigue, it's the intensity of the stretch, which is very, very important to look at, and the technique. I think these two, intensity and technique, are the most important variables that needed to be considered. So, what do I mean by that? If your audience looks at the first diagram, figure one, numerical rating scale, what I found with my research is that most, if the stretch is held, if the stretch is done very gently around a 3 or 4 out of 10, I found that basically the body responds in a manner where it doesn't cause inflammation or inflammatory response, as you well know. And you are my teacher because I'm not how do you say, knowledgeable in the field of arthrofibrosis, that the inflammation is something that needs to be somewhat rectified and ameliorated in order to help the joint recover properly. So what I found with my work is that the stretching needs to be very, very gentle. And more importantly, also the technique that you use for stretching, which we're going to discuss later on, is something that also has to involve supporting the body itself. Yeah.
Okay. Reading this and having the possibility also to have the graphic support, which is great, while you're talking over this. How would you say, I mean, are you comfortable in discussing the result of your research applied specifically to knee arthrofibrosis, obviously stretching wise?
For sure, for sure. I am very comfortable in taking what I've learned in order to help what you and the IAA are doing, which is to provide more information and knowledge to people suffering from this. For sure, definitely. Yeah.
Okay. Let's talk about, scar tissues, which is in the end what we are dealing with
Mm-hmm.
these knees. Let's say open question. What do we mean by scar tissues, and also how they react to stretching, maybe stretching done properly, as you were mentioning.
Oh, for sure. Again, from my research with regards to scar tissue, I define it, or I see it as, and defining it as, an excessive accumulation of fibrous connective tissue, mainly observed as disorganized extracellular matrix. So, which, as you well know, the extracellular matrix is the non-cellular scaffold that surrounds and supports the cells. So, with scar tissue, it's especially in wound repair, we see an excessive, as you already mentioned, an excessive accumulation of fibrotic connective tissue by you mentioning the myofibroblasts. And in particular, what I've seen through a lot of my research and what I've read is that there's an accumulation of collagen as a consequence of chronic inflammatory response. So the thing that's very, very important and is regard to how we actually deal with the inflammation that we have in the body and how the body, how we try to help the body recover with what it's sort of dealing with at that particular moment in time through the disease or an injury. Yeah.
Okay. Let's get into maybe, if we can, deeper details, also looking at this graphic representation. Can you explain us a little bit better how scar tissues are connected, I'm sorry, connected to, cells, and also what is the effect that we are gaining? What is it we are actually provoking in the body as when we provide adequately prescribed stretching at this level, so in between the scar tissue and the cells, and also maybe we can introduce also the concept of mechanotransduction, which I see in the legend of the figure.
Yes, thanks you. But what I'd like to sort of discuss is how does the body respond to stretching? And again, so we need to look at stretching as a mechanical force, a mechanical load. And in this diagram here, what I've done, and you're rightfully so, it is discusses the mechanotransduction, but what I tried to sort of impress upon the audience is that the body actually gains information from its environment mechanically and chemically. So, but we're looking at a mechanical response. So, with mechanical load, it plays a very important role by which cells recruit, proliferate, and undergo their ability to recover to the mechanical stress that they're being exposed. And more importantly, what's happening at the cellular level and how the cells interpret the mechanical force and then cause a biochemical response, which we call inflammation or an inflammatory response biochemically. So mechanical stress, I also believe, leads to fibroblast accumulation, and which is an interplay with inflammatory cells. So a greater tension associated with mechanical stress, like say with regards to stretching, excessive stretching, I think, can contribute to the progression of fibrosis through the modulation of the immune pathways. So the thing that I have really looked at is how these immune pathways stimulate the cells in order to lay down the fibrotic tissue. Okay. So, but what I found interesting in a lot of my research in the past is that I don't know how true through your work that you've done is I believe that treatment sometimes begins relatively late in the course of an injury or a disease. Do you agree?
Unfortunately, I do, which is part of the problem. Yeah.
Yes. So suggesting that the process of hypertrophic scarring has already been well established. So that said, I think there is a discrete window early in one of the phases of wound healing, which is the middle phase, because you have the innate immune phase, then you have the second phase, which is the proliferative phase of wound healing, where I think that's when, if we introduce proper forms of therapy, again, I'm only speaking with what I know. So at that phase, when I introduce very gentle stretching done properly, could it aid in the recovery and regeneration of the body? I believe it does, because what we're trying to do is we're trying to ameliorate any more inflammation happening to the body itself. Again, and because I believe that if we create more excessive mechanical stress, this further activates inflammation in the inflammatory response. But what I found really interesting, Sebastiano, upon my reading as I was preparing for this podcast, is I found that a paradox exists in wound healing with the less matrix deposition is just as strong as with healing with abundant matrix, abundant by meaning that where we have more fibrotic tissue development. So one author suggests that the scarring may represent, so the excessive scarring may represent a phenotype of the normal physiological response to mechanical tension. So maybe that extra matrix present in the scar formation may be too rapidly and abundantly deposited to actually be amenable to the remodeling and reorganization that is critical for scar strengthening. So again, my belief is that excessive and disorganized matrix that is developed through excessive mechanical stress, that this may not contribute to the overall scar strength. I don't know if that makes sense, but
It
that's
does.
what I've looked. So now the question is, can you explain? So that my next thing is basically looking at the connection between how you already touched upon, how is scar tissue connected to cells? And then the concept which we just basically briefly touched upon, mechanical transduction. In this diagram here, what I basically wanted to do is a visual just showing individuals that if you actually have mechanical stress and it causes tissue damage or tissue injury, this is how the body responds. So firstly, we have seen the mechanical force that results from stretching depends on the magnitude and the rate of the stretch. And I believe that can influence the body both macroscopically and microscopically. And the other thing that's very, very important is, how does scarring occur? And there are three primary stages that we look at, as we mentioned earlier. There's the innate immune system stage, and then there's the proliferative stage. Sorry, everybody. And the important thing to look at is when there's tissue injury, the vascular bed is affected. So the circulation is affected. And one thing that gets affected is what we call the residential monocytes. These are basically cells that are resident in the area of injury. And when the tissue is injured, they release a chemical. They release chemicals which we call pro-inflammatory cytokines, specifically interleukin-1 beta and tumor necrosis factor alpha, as you can see in the diagram over here. The interesting thing about these two cytokines is when they're released, they actually act as attractors for the neutrophils and the macrophages, which are basically the immune cells that are going in there to try to help the body heal and recover. The neutrophils go in there, they clear up all the area that's been inflamed, and then the macrophages go in there and eat them up as well in order to have that area, ready for what the next phase is, which is the proliferative phase, which basically means that now you have an influx of what we call the fibroblasts. And the fibroblasts are very, very important because, as you rightfully touched upon earlier on, they differentiate into the myofibroblasts. And it's the myofibroblasts that actually are important for wound healing, and they are characterized by releasing what we call, let's call them little fibrils that basically connect with the other fibrils that are being released by the myofibroblasts. So you have a whole contingent of them inside the area that's been injured. And they are important because they deposit the extracellular matrix that we talked about, like the collagen and the fibronectin, which is very, very important. So if the switch from the proliferative phase to the next phase, which is the remodeling phase, which again, you touched upon beautifully by saying it's a cyclical thing. If that switch is it doesn't happen properly and there's no control, then that leads to increased scarring due to chronic inflammation, which is very, very important with regards to what you're dealing with. Yeah.
Thank you. Pretty clear, actually, and good overview. So let's say in the end, for physical therapists, athletic trainers, whoever is clinically dealing with these patients, let's say we have an ongoing scar tissue contraction. So this is happening. How often we should provide stretching? How often we should, stretch our patients?
That's a very good question. And I'm going to sort of switch it around a bit and say, I'm it's not the tissue contraction that becomes more of the issue. I think what we have to look at is how that tissue contraction affects the body and results in compensatory shifts. Okay.
Yeah.
So what do I mean by that? So I think repetition is a very, very important thing. So you need to do stretching repetitively. And from my observations and from what I've said, it has to be done gentle. Okay. Because repetition is an integral to motor learning and pattern formation. And the thing that we look at is if there is an issue concerning how repetitive contractions can cause compensatory shifts, we have to basically look at how is the body being loaded in order for it to, how do you say, properly function. Okay. So I'm saying that these shifts are more likely to create patterns of movement that alter proper mobility. And more critically, they may lead to some muscles being loaded more in order to protect the injured side. Okay. Mm-hmm. So what this means basically is that the pain associated with any injury or disease may cause an involuntary shift of the load from the affected limb joint towards the sound and uninjured joint or limb, leading to what I believe is future issues with this limb joint. These compensations become an automatic response, which in turn may cause a repetitive strain or injury to the unaffected site, as well as in the proprioception system of the body. So having said that, the frequency of the stretch, provided this, again, this is my observation, provided that it is gentle and pain-free, allows one to master a more normal pattern of movement. According to my observation and research, the recommendation for any self-stretching where the person is doing the stretching on their own would be to perform 3 repetitions of a stretch per muscle group daily. Okay. For example, what do I mean? If a person stretches their left calf muscle, they will hold the stretch for 60 seconds. We're going to get into the principles of microstretching later on, at an intensity level of 30 to 40% of a maximum perceived stretch, as we showed in the diagram earlier on. Let's go back to that diagram. Here we are. So again, as we said earlier on, the stretch has to be held at around a 3 or 4 out of 10. So a low intensity stretch. So again, and then the other thing too is that here's the one thing that is very, very important with regards to stretching is don't just focus on the one limb that is the issue. It's very, very important to also, as we said earlier on, to focus on the other limb that's not the issue, because now this is being loaded in a manner that may lead to future issues later on in how do you say, later on in life or in age. So it's very, very important. So having said all that, just to summarize, the stretches are held for 60 seconds at a 3 or 4 out of 10, as we said, very low and gentle intensity stretching. And they're repeated 3 times. That's the key. So you would hold one stretch for 60 seconds on your left calf, then you'd go and do the right calf for 60 seconds and then repeat it 2 more times. So for a total of 6 minutes of calf stretching. And again, this is self-stretching. Okay. Yep.
Okay, clear. Let's extend this to the micro-stretching principle. Can you tell us more about the technique per se of the micro-stretching approach? And also, you kind of anticipated this, but what are the main principles?
For sure. Microstretching, as we said, is a very gentle technique. So by that, I mean that you're not going to have any pain or discomfort in the stretch itself. And it consists of basically four attributes, which are, as you can see, the intensity, duration, frequency, and volume, and two principles. So the intensity of the stretch, again, this is based on my research, and what I found is around a 3 or 4 out of 10. So basically that means uh, probably the best description would be it's as if you're putting your hand in lukewarm water. It has to be very, very gentle, very, very calming, the stretch itself. Okay. And then the duration is held for about 60 seconds. And as we talked about previously, it's repeated 3 times per muscle group, once per day, and done daily. Okay. So the other thing too that's very, very important with microstretching is uh, two principles that are associated with it. The first principle looks at body position, which as you can see in this diagram, we call stability, balance, and control. But what does it basically mean? It means that you have to place the body in a position where it is supported and you are eliminating as much muscle contraction as possible. So if you look at this diagram here in figure A, the person's trying to stretch his calves, but that to me is not a proper calf stretch because the calf muscles are also active at the same time in order to try to support the body to stabilize it. So you're now trying to stretch a muscle that's active. And that to me is counterproductive. So what you're doing is you're creating an isometric contraction. However, with microstretching, you place the body in a position, as you can see, these two stretches, B and C. The B refers to the soleus and C refers to the gastrocnemius. You place the body in such a position where you offload the muscle that you want to stretch in order to have more control and, more importantly, be able to feel the proper gentle stretch. Okay, so that's the first principle.